Quality care has taken on new meanings, I think, since I became a physician. As time has evolved, there's been an explosion of knowledge, an explosion of potential testing that one can do. So the Choosing Wisely campaign brings us back full circle. Always wanting to do the best for the patient, but then looking at the best evidence that exists and including that in our recommendations.
Choosing Wisely has become a really important national and even international narrative within the quality movement. And ASH needs to have a presence there, and now does have a presence there.
What this is asking physicians to do is, before you choose to use selected procedures or interventions, that you think carefully about whether it actually is the best choice for your patients. The Choosing Wisely campaign was initiated by the American Board of Internal Medicine Foundation. The recommendations of the Choosing Wisely campaign are picked because we believe that these are interventions or procedures that physicians should really carefully consider when they apply them to patients, because the evidence really doesn't support their use or supports their use only in very selected circumstances.
There are 5 items on the Choosing Wisely list, and we went through a rigorous process to identify those 5 items. And the guiding principles that we used were harm, evidence, costs, frequency, and control.
All 5 of the items on the Choosing Wisely list involve decisions that I make regularly, issues that I deal with all of the time in general hematology and oncology practice.
Not a day would go by where I didn't have to consider one or more of the tasks on the Choosing Wisely list. And it's either an interaction with a colleague or with myself.
I want the Choosing Wisely campaign to impact the dialogue that occurs between hematologists and their patients.
Gone are the days when the physicians say, this is what you should do. It's now, here are the options. Let's decide together the path that you want to take in your care. It is vital and underlies everything that we do as a practitioner of hematology and the care of patients with blood disorders.